Hi everybody, welcome to Treatment Tuesday. Today I'm going to talk about a type of treatment that I have received throughout my illness, and this is a type of physical therapy known as visceral manipulation. So it does sound a little bit out there, but it is a scientifically based type of physical therapy. This type of physical therapy was developed by French osteopath and physical therapist Jean-Pierre. He was working with his patients when he realized that a lot of them were coming in with complaints, organ-related complaints, but he started to notice that the structures outside surrounding that organ were also in distress. So he started making this association between the external structures of the body and the internal dysfunction of the organs. So he developed visceral manipulation, and this type of physical therapy can actually help a wide variety of conditions, not just, like sports injuries or injuries related to, a car accident, that kind of thing. It does help that, but it can also help gastrointestinal problems like acid reflux and GERD. It can help carpal tunnel, breathing issues, and also anxiety and depression. And I know that sounds a little bit out there, like how can physical therapy help anxiety and depression? But he has a scientific basis for this. So basically, the theory behind this is that every organ has an inherent movement. And we know this to be true because the heart is the most obvious of all of these organs. The heart beats. We can actually feel it beating if you put your hand on your chest, and it has to beat in order to move blood around your body and in order for you to stay alive. So the theory extends to all the other organs. The heart is not the only organ that moves in order to perform its function. Your ovaries, your liver, your lungs, every organ in the body has to move in order to perform its function. When these organs are restricted due to exterior issues in the muscles, the fascia, the bones, then the organs cannot perform their function, and that's when you start to get health issues, for example, like GERD and breathing difficulties. So Jean-Pierre developed this type of physical therapy. It's a very gentle, non-invasive type of physical therapy. It basically works, with light palpations on the area that's in distress. And, the physical therapist sort of imitates the movement of the organ, because each organ has a specific type of movement. And they sort of try to manipulate the exterior to sort of manipulate the organ to go back to its inherent original type of movement. That way it can continue to perform its job the way that it was doing before. So I discovered this type of physical therapy because I started having neuromuscular issues in my body. Something happened to the muscles on the right side of my body, and I started having trouble breathing. You can sometimes tell when I'm recording I'll have trouble breathing if I'm talking too much. But I also started having stomach problems as well. For me, it was very, very obvious that the muscle issues on the right side of my body were causing the internal issues. But for a lot of other people, this is not as obvious. In those cases, physical therapists will use something known as a thermal evaluation technique in order to identify the areas of distress. So when I first started going to physical therapy, my therapist would lay me on the table and she would run her hands along my body. Very, very close, but she wasn't really touching me, but it was very, very close, kind of like grazing the body. And basically what the physical therapist is doing is that they're feeling for areas of increased heat. Typically, wherever there's more heat, that's where the problem is. So for me, it was very obvious. She already knew it's the right side of my body. She could actually see that I was pulled in, but she could use the thermal evaluation techniques to see if there were other parts of my body that were also causing these issues. So that's basically the short description of visceral manipulation. I believe it's a very, very good type of therapy, very effective. If you have any type of, pain in your body or body dysfunction, or you want to try a less invasive, drug-free way to ease, maybe gastrointestinal issues or breathing problems, you may want to try visceral manipulation. If you want more information, you can Google the Baral Institute, and that's the official website of this type of physical therapy and other modalities that Jean-Pierre Baral has developed. And it'll give you, complete description and history of this type of physical therapy, as well as a listing of practitioners, because not every physical therapist knows this. This is a more advanced type of physical therapy, and you really, if you want a physical therapist that is good at this, you will have to look on that website for certified practitioners. So take a look at that if you want more information. I highly recommend this type of physical therapy if you're looking for something, if you have a very complicated case of something you can't figure out where your pain's coming from or where your dysfunction is coming from. You've seen doctors and you just can't figure it out. This type of physical therapy may be helpful to you. So that's my Treatment Tuesday for today. Stay tuned for more treatments. I'll be making a treatment playlist, and I'll be making other playlists as well, so stay tuned for that. I'll see you guys again very, very soon. Take care, everyone.